I'll turn to you, Dr. Sharma, now. How exactly do you diagnose coronary artery disease? What are the diagnostic tools for diagnosing the disease?
See, the basic diagnostic tool starts with a good clinical and risk factor history taking. Most of the time, one can make out with this a particular person, his demographic profile and type of symptom, whether it is a coronary artery disease or not. But yes, we need to have a more objective proof. To have an objective proof, basic investigation is electrocardiogram. So basic ECG, sometime first ECG in setting up new onset, sudden onset chest pain, first ECG may not show changes. So one has to repeat after 1 hour, 2 hours. Or the people who are having so-called angina without having heart attack, the ECG may be normal. Okay. So basic tool is one ECG. Second to that is the blood investigation. We can do a point of care test like troponin T or I in setting up acute chest pain, whether this chest pain is of cardiac origin or non-cardiac origin. Okay. Third is a basic, nowadays, in major hospital, echocardiography is available. One can immediately see the heart muscle. Right. So whether is there any area of the heart muscle which is weak, which is not contracting, so one can make out. Even sometimes ECG is normal, we can make out an echocardiogram. So when these tests are done, these are the basic non-invasive testing. Right. The people in whom the suspicion is of so-called low or intermediate probability of heart disease, young person coming with atypical symptom, then one can go for a CT angio, CT coronary angiography. CT coronary angiography has a very high negative predictive value. One can rule out coronary artery disease very well. Or CT angiography has added advantage. Some of the other critical illness which can give rise to chest pain can be ruled out. And next to that is, suppose when we are sure that person has a coronary artery disease and these investigation like ECG, echo, there in concordance, there is a suggestion that person has coronary artery disease, then final test is a coronary angiography. Coronary angiography is a gold standard to diagnose obstructive coronary artery disease. It is a very simple test done through the small puncture either through the arm or in the groin, and a fine 2.5 millimeter diameter catheter is inserted under local anesthesia, and we can picturize coronary artery. We can define extent and severity of coronary artery disease very well. So coronary angiography is a gold standard test to diagnose coronary artery disease. Right. Now, CT coronary angiography is there. Yes, it is to be utilized for a screening purpose in the people in whom the probability of coronary artery disease is low or intermediate, or whenever we want to screen a high-risk population which is not symptomatic, then one can have a CT coronary angiography. But those people in whom symptoms are very much suggestive, ECG changes are there, it is good to have conventional coronary angiography to define extent and severity of disease and to decide the modality of treatment, whether we leave them on medical treatment or percutaneous intervention or surgical revascularization.
Right. So, sir, you made a distinction between conventional coronary angiography, which is invasive in nature. You described the process, and I suppose it's an absolutely safe procedure in hands of competent doctors like you. And you also talked about the second kind of angiography, which is CT angiography. And you said that the potential patients groups for both kinds of angiographies are different. That people with high risk profile, but people who are asymptomatic, who have no symptoms, they should go for a screening as far as CT angiography. Yes. So, sir, would you say that CT angiography gives as accurate a result in revealing CAD as the conventional angiography?